How many times have you been into hospital with a sickle cell crisis and you know it's your typical sickle cell crisis pain that's in your bones or joints, probably in the same place it's been before, and you go in and you get asked a load of questions by healthcare professionals, and then those questions are repeated by various other healthcare professionals during the time that you're there and you're still in pain or you're really drowsy from pain medications and tired and just want to be left alone to, sleep and rest. But people are asking you questions. And have you ever wondered the reason why the different people are asking you the same questions rather than just communicating with each other? One of the many reasons that I can think of for this, from the perspective of actually being a doctor, working in hospital, having to review and admit patients, is because the communication is really bad between different healthcare professionals. If you ever actually look through your handwritten notes file and try to read it, the medical jargon wouldn't be the problem. It'd be the fact that the handwriting is just so bad that you can't read it. So there have been multiple times where I've actually had to go to a patient and ask them basic history questions again, because I just wasn't able to read the notes in that someone else had written. And history is important because even if you have explained, you were exercising or you were out in the rain and the cold and doing this and that and the other, and the pain started to occur, it's up to the person who's listening to you to interpret that and write it down and record what you said. You don't know what they're going to have recorded. So when another doctor or healthcare professional then comes along to read that, they may not have enough information based on what someone else has written. So their job is to basically understand the situation fully so they can exclude other potential causes and figure out if there's any other things that need consideration. And sometimes they can only do this by hearing from you directly, because otherwise it's just kind of Chinese whispers. I know that it can be annoying when different people are asking you the same questions and you feel like you're having to repeat yourself. But it does come from a good place of wanting to do a good job for you and wanting to make sure that you are looked after. So I thought I would just share that perspective because it's something that I've experienced from being a doctor caring for patients, as well as being a sickle cell patient, annoyed and frustrated at having to repeat myself. So just bear that in mind, that unless you're being recorded by AI and it's all being documented nice and neatly on a computer, that sometimes it's best for healthcare professionals to ask you the questions themselves so that they can hear and interpret the information in order for them to best be able to help and care for you. So let me know what you think about repetitive questions and any other ways that you feel processes in your hospital could be improved.